I have found very useful is that you can be honest about your good things and your bad things. I mean, everybody likes to brag about their program. Let's say you have an issue with readmissions, or let's say you have an issue with ICU length of stay, or ventilator length of ventilation, post-operative ventilation. These are the kind of things that we can discuss in an open forum and learn what other people are doing, good, bad, or otherwise. When you're able to be honest with other programs and say, hey, you know what, they're doing something different that works. Maybe we should investigate that. And this AboutHealth allows us to be quite honest with each other. I really like that. One of our issues has been readmission, so it was nice to be able to talk to some of the other programs and get an idea of what they're doing to try to avoid those readmissions, because as we move into the future, those readmissions are going to cost us more and more. And those are the kind of things that you can talk about and get an honest answer.
Being able to share best practices in the collaborative format is again really powerful, because we're actually looking at metrics and how we're going to improve referral and participation in cardiac rehab. I am very excited because although cardiac rehab has always been important to Aurora and cardiac care, we are taking it to a higher level. So we now have a cardiac rehab optimization group with two vice presidents, Mia Stone, who is our senior administrative director, myself, and we have a project manager. And so we have a goal of improving cardiac rehab referral and participation into cardiac rehab.
I had the opportunity to go up to the AboutHealth in December to actually look at cardiac bundling and look at best practices for cardiac bypass surgery, acute MI, and for cardiac rehab. And it was really great to go and meet with all of the various people to hear what it is that they're doing, what kind of good things that they have going on for process improvement. And it was really nice to actually have physicians there that you could bounce things off of and have them really think about what they're doing in their practices, and whether it be in the clinic or within the hospital. So we had really good discussions. For me, sitting in the cardiac surgical section, understanding where patients are at from as soon as they are discharged. Some of the practices are calling patients on a daily basis to see if they have questions. So we brought that back to the offices, and it is one of the things that they have implemented. It is important to make those connections. We cannot be siloed as just a system. I believe that we have certainly things we can offer other systems and vice versa. And again, it's about the patient care and what are we doing in this fast-paced, quickly changing healthcare environment. We have to be nimble. And in order to do that, you have to connect with others.
I think we've always looked at our data from a national level. So we always would look at our benchmark data and how we compare it to the rest of the nation. This really gave us an opportunity to look at how we are in the state of Wisconsin. And I don't think we would have been able to do that without the collaborative. One of the things that I walked away with from the collaborative was cardiac rehab. I was so impressed with some of the rates of participation in cardiac rehab. And probably the one I really liked the most was as you're providing the education for an angioplasty procedure or for bypass surgery, that you present the whole cardiac rehab and the procedure as this is part of your treatment plan. It's the procedure and it's cardiac rehab, and presenting the whole package deal. And that's really what it is we want for the patient. I really like those strategies, and we're going to be adopting those. I think that check-in really provided a great opportunity to say, wow, here's where everyone is in their stages of implementing best practices. And these people have done it really well, so I can just tap into that and call them. So that check-in was really it's a summary of what we've been doing, but it's also has it right in front of you in black and white, who's doing things well.
Working with the other systems within AboutHealth has been a great thing for our organization. It's really given us exceptional providers to be able to bounce our ideas off of. It's given us examples from their own organizations of where they found to be easy successes and easy wins. And it's allowed us to go back and actually look at our programming to make sure that we're headed in the right direction for bundled payments and everything else that's going to come down the road for us. So for the collaborative that we had in December in Wausau of this year, we had providers go to that, we had staff go to that, we had administrators go to that, and we all came back and within a week or two period of time really delineated a list of things that we thought that we could accomplish in our organization and set time frames to them. And so that was really very helpful for our program to be able to reach out to the other AboutHealth providers and to really see where they've had wins, and then allowing us to go back and look at, okay, we thought this piece was going to be challenging, but look, it was actually pretty easy and Wausau was successful with it. Or we ended up with a really great resource from AboutHealth through Aurora for chest pain center accreditation for us. And so a lot of those things that we've really always wanted to do for the past couple of years really actually ended up achievable within Pro Healthcare as we looked at our other partners in AboutHealth. Everyone is engaged, and that I think is the nicest part of all of it. The two leaders for both cardiology and CT surgery were at the collaborative with us, and so really heard from the other organizations that this was a really important thing, to really having a multidisciplinary case review for patients so that we're treating the right patient at the right time with the right type of procedure and the right provider. Dr. Cyan made some great partnerships with physicians from other organizations and has used them as resources since then. You know, as we've looked at the radial artery approach in the cath lab, and some organizations have been super successful with it, and we've been successful in pockets, but not overall for our program. Him having those people to reach out to say, yeah, it's really not that hard, you just got to kind of do it, has been really great.
I think that being part of AboutHealth helped us. For example, I can think of a specific program, radial. We've been trying to move forward with radial caths, and we've made some progress, and we thought we were fairly ahead of the curve. However, when we compare ourselves within AboutHealth, we saw that we were ahead of a couple of systems, but well behind some other ones, and that surprised us. And gave us, I think that sharing that with my partners gave us all a new impetus. And we've met since that collaborative, all the cardiologists, the interventional cardiologists met. And we thought that, yeah, this is something we're going to bring forward and accelerate. And we've designed a plan and are working with administration on how to bring it up on board. Yeah, I think that was a good example of where we learned something and put it into action pretty quickly.
What we realized is that our data wasn't as robust as the other organization. So we discovered different ways other organizations manage that piece and how to do it better, which made me more curious, and I went to the NCDR conference in March and learned more about it, and we're already using this knowledge to improve our processes and our data quality. Because it was practical things that are more in the day-to-day practice, not like when you go to a conference and you have the theoretical and the studies, it's different. This is about their day-to-day issues. And sitting in a room with 30 interventionalists discussing their challenges they all felt rewarded, and our doctors too. So another improvement was about radial approach to cardiac cath and PCIs. Our physicians, the more recent additions to our team, have been doing radial, and their perception was that they're doing it most of the time. When we looked for the data and found out that it was like 30% only, they didn't believe it. And then, we kind of validated the data and what would be best case scenario and how to get there, and what are the the cases that it can replace a femoral approach. So this just putting the data out there made a huge difference.
To learn more about collaboratives and what they mean for you, visit AboutHealth.com.